Onc Live Insights is a video editorial program produced by Onc Live.
When the B-cell receptor pathway inhibitors were first studied in phase 1 trials, a very interesting phenomenon was observed. In CLL, our response criteria typically require that the white blood cell count decline. However, with these patients, it was noted that patients felt better almost immediately, had shrinkage of their lymph nodes under our eyes, but at the same time their white counts started to rise, sometimes quite dramatically. In the early days, some patients were actually taken off the drugs because of fear that this represented progressive disease. But what became clear over time was that really this is likely a redistribution phenomenon of cells out of niche sites, including lymph nodes and bone marrow, into peripheral blood. This likely occurs because ibrutinib blocks the signals within the CLL cells that keep them in those niche locations. And the cells then redistribute into peripheral blood, where they likely die at a somewhat enhanced rate because they're not receiving the support from the microenvironment that they would still be getting in the lymph nodes and bone marrow. As a result of this, the response criteria for CLL had to be adapted. Historically, a rise in white count was indicative on its own of progressive disease. This has largely been eliminated for patients treated with BCR inhibitors, and we base our response criteria on nodal disease and take into account the white count in a new category of response called partial response with lymphocytosis. So a partial response with lymphocytosis is for those patients who have at least a 50% reduction in their nodal burden, have at least one preserved cell count, yet have a lymphocyte count that's above the normal 50% reduction from baseline that would be required for a full IWCLL partial response. Most studies with these drugs report both the PR with lymphocytosis rate and the full IWCLL PR and CR rate.